Chapter 4, Skin and Subcutaneous Tissue. The composition and function of the skin. The composition is the skin, subcutaneous tissues, hair, nails, sweat, and sebaceous glands. And the function is the first line of defense, temperature regulation, sensation, synthesis of vitamin D, and the elimination of waste. The skin and the subcutaneous tissue, hair, nails, along with the sweat and sebaceous glands, are all parts of the integumentary system. The term integument means a covering, although the term integumentary is only used as a collective name for the system. There are many combining forms, prefixes, and suffixes to learn for all of the structures to be described, and the ICD-10 calls the system, the skin, and the subcutaneous tissue. Now, your word parts is part of these things is if you've never heard of a disease or disorder when you're in the office, if you know your word parts, you'll be able to take that word part and try and decipher on what the diagnosis is. For example, dermato, cutane-o equals skin. So if you heard, for example, dermatologist, ologist is the study of, and derm is skin, so that would be the study of skin. Then you got the word part sub, which is under. Tricho or pilo is hair. Onchi-o or ungo is nail. Hydro, sudor or sudii is sweat. Sebio, sebatio is oil or sebum. The skin is arranged in layers. The top layer is the epidermis. Epi meaning above or upon, and dermal for skin. And the is is for structure. Hence, the epidermis is the top layer of skin. It is vascular, meaning that it has no blood supply. The dermis, also called the corium, is a true layer of the skin. It holds the blood vessels, oil, and sweat glands, and nerves for sensation. Underneath is a layer called the hypodermis. Hypo, meaning under or beneath. Dermo, again for skin, and is is for structure. The other name is the subcutaneous tissue. So when you put the two names that both refer to the structure under the skin, this tissue is filled with fat, adipo. So when you look at your word parts over on the left side, you've got the epi equals above, dermo, skin, A is no or not without, vascular, O is vessel, AR pertaining to, hypo equals below, sub equals below, cutano is skin, adipo or lipo is fat. The epidermis is composed of mostly avascular tissue, meaning that it has a very limited blood supply. It covers the body and is arranged in layers, and these layers have a scaly appearance. The medical name for the structure is the stratified squamous epithelium. And once these cells are formed, they are pushed upwards towards the outermost layer, the stratum corneum. As they are pushed towards the surface, they are filled with a hard protein material, keratin, and are then referred to as keratinocytes. The addition of the keratin to the cell gives them the protective waterproof property. The deepest layer of the epidermis is the basal layer, also referred to as the stratum germinativum. This is the site of continual new growth for skin cells, along with the production of the substance melanin, which gives skin its color. Pigment are the melanocytes that produce a dark pigment called melanin. In the presence of sunlight, the melanocytes increase the production of melanin, providing a form of protection against ultraviolet light. From the deepest to the top layer, in order, are the stratum germinativum, the stratum spinosum, the stratum granulosum, the stratum lucidum, and finally, the stratum corneum. Now, if we're taking a look at the word parts for this, so you got your squam-o equals scaly, baso is basal, germ-me equals sprout, nate-o equals birth, corneo is hard or horny, carato is hard or horny, site equals cell, in equals substance, and melano equals black. And here you have the diagram of the skin. So now you can see how in reality it really looks. So here you've got your stratum corneum, your stratus lucidum, your stratum granulosum, and then the stratum spinosum. Okay, the dermis is composed of vascular connective tissue. Now remember that the synonym for dermis is the corium. While the epidermis is the covering, the dermis is the tissue that is being covered. Vascular in nature and composed of connective tissue, the dermis is also the site of the nerves, hair follicles, touch receptors, and pseudophorus, which is sweat, and sebaceous glands equals oil. Meisner's corpuscles provide sensitivity to the light touch, while the piscinium corpuscles sense pressure. And then over on your left side are your word parts. Follicular is follicle. Hydronan-O is your sweat gland. Okay, subcutaneous tissue. Remember that the subcutaneous tissue is under the dermis and is composed of mainly adipose. So with your word parts, adipo equals fat tissue, which serves to insulate and cushion the body. And over on your left side, you've got word parts. Sub equals under, cutano equals skin, -os is pertaining to, adipo equals fat, and os equals pertaining to or full of. Here is a review question. The hair follicles are located in the A. dermis, B. epidermis, and C. subcutaneous tissue. So where do we think the hair follicles are located? And if you guessed A. dermis, you are correct. Great job. Okay, the pseudophorus glands, also called the sweat glands, are instrumental in the regulation of body temperature. Note that the combining form for the sweat glands is hydronono, and the composite of hydro for sweat and adeno for gland. You may see that the term sudor used to mean sweat, but is very rarely used. Perspiration is a much more common term for the process of sweating, and it occurs through the tiny openings in the skin called pores. These pores are present on the soles of the feet, the palms of the hand, the axillae, the upper lip, and the forehead. There are two types of sweat glands: the eccrine glands, which are located in the hands, feet, and forehead. Their name is derived from this secretion to the outside of the body. And the other apocrine gland, which are named for their action as part of the gland, being broken off and secreted with sweat before it is discharged to the surface of the body. The apocrine glands are located in the armpit and the groin. Sebaceous glands secrete an oily substance termed sebum, which serves to lubricate the hair and the skin. Its acidic nature helps inhibit the growth of bacteria. Note that the combining form is not tricky. It's simply sebo. So over on your word parts, you've got sudor or equals sweat, ferrous equals carrying, hydro equals sweat, hydrono is sweat glands, ek equals out or outwards, crin to secrete, apo is separate away from, and sebum equals sebo. The combining form for hair are tricho, pronounced as trick or treat, and pilo. The root of each strand of hair is in the dermis, along with its covering, is referred to as the hair follicle. The part of the hair that you can see is called the shaft. The underneath is the shaft is the nipple-shaped structure called the papilla. You'll find that the combining form for the papilla, papillo, is used throughout terminology in the terms for eye and obviously in the female reproductive system. The cells on the top of the papilla are responsible for the formation of hair. When these cells die, for whatever reason, hair loss occurs. Hair is colored by the pigment melanin, and the emelanin gives hair a black or brown color, while the pheomelanin results in red or blonde. And if you're looking over at your word parts, there's got tricho or pilo equals hair, folliculo is follicle, papillo is papilla, ew is healthy and normal, or pheo is dark. Now the nails have two combining forms. You got anchio or ungo. They cover the dorsal surface of the distal ends. And remember that distal pertains to the back, and that distal means far, of the fingers and the toes. Note that it is an atomic position with the palms forward. The nails face the back of the body. The visible surface is the nail body, also called the nail plate, with the nail root being just under the skin at the base of the nail. The nail bed is highly vascular, which means it's blood-filled. It's tissue under the nail body, and the small moon-like area at the base is called the lunula, meaning a tiny moon. The cuticle is the skin upon the nail, and the princium is a small fold of skin that is at the sides of the nail, littering near the nail. The hyponychium is the skin distal to the nail bed, under the free edge of the nail plate. It is also referred to as the onchodermal band. Now when you look over at your word parts, you've got onchio or ungo is nails, epi is above, hypo equals under and below, par equals near, and stands for structure. Did you know that as the ability to see smaller and smaller body structures became possible, early anatomists named them according to what they resembled that was already named. For example, the nipple was the first structure called the papilla. Later, the term papilla was also used to the name projecting capillaries at the bottom of the hair shaft, the cuneiform-shaped entrance to the optic nerve, and the taste buds on the tongue. But do be careful. Do not confuse papillo meaning papilla or nipple with papullo meaning pimple. Okay, here's a review question. Which layer of the skin is largely avascular? Epidermis, dermis, or subcutaneous? So remember that this would be the top layer with a very minimal blood supply, but several layers of its own. And that would be a epidermis. Definition of lesions. A lesion is any visible localized abnormality of the skin. Primary skin lesions are the ones that initially occur as a result of trauma or disease, and your secondary lesions are those that have evolved from their primary form. Nodules are palpable, solid lesions, for example, a lipoma. Cysts are nodules that are filled with semi-solid materials, like a keratinous cyst, also called a sebaceous cyst. Tumors are nodules that are larger than 2 centimeters, slightly less than an inch. The term tumor can be used to explain any mass or swelling, including neoplasms. The hematomas are collections of extravasated or leaked blood that are trapped in the tissues and can be felt by the examiner. With your word parts on the slide, you've got nodo is not, ule equals small, cysto equals sac or bladder, hemato equals blood, and oma is tumor or mass. An ecchymosis is a hemorrhage or an extravasation of blood into subcutaneous tissue. It is not palpable, but generally darkens the skin. You may recognize it by its common name, a bruise. The petechia is a tiny ecchymosis in the dermal layer. A purpura is a massive hemorrhage into the tissue under the skin. And all these terms are forms of extravasation, which means a process of a substance, either blood or lymph, leaking outside of a vessel into surrounding tissues. Your word parts for the slide: ek equals out, chimo is juice, osis abnormal condition, purpuro is purple, and the hyphen a equals noun ending. A macule is a flat, non-palpable blemish or discoloration that is less than 1 centimeter. Some examples could include freckles, port wine stains, or even tattoos. A patch is a large, flat, non-palpable macular that is larger than 1 centimeter. This could be a larger port wine stain or a tattoo as well. A papule is a raised solid skin lesion that is less than 1 centimeter. A pimple could be an example. A plaque is a raised plateau-like papule larger than 1 centimeter. Psoriatic plaques or seborrheic keratosis are some examples. A wheal is a circumscribed, elevated papule that is caused by a localized edema. Some examples of these could be bug bites, urticaria, or hives, are wheals that are caused by an allergic reaction. Now, if you look at the word parts, you got macula is spot, papulo is pimple or papule. A vesicle is a circumscribed, elevated lesion that is filled with fluid and smaller than a half a centimeter. If it's larger than a half a centimeter, it is termed a bulla. In English, we refer to these as blisters. A pustule is like a vesicle, but it is a raised lesion that is filled with pus as a result of an infection. Finally, telangiectasia is a condition of dilated superficial venules and capillaries. And then your word parts would be vesiculo is blister or small sac, pustulo is pustule, tele is far, angio equals vessel, and ectasia is dilation. If the skin is atrophied, it is characterized as being paper-thin, wasted skin. An example is the thinning skin of the elderly or stretch marks that result from rapid weight gain. The specific term for stretch marks is striae. Don't confuse that with the term of the layers of the epidermis, which is strata. A cicatrix is a scar. Now your word parts: A equals no, not without, trophy, process of nourishment, or eschar O is scab. A keloid is an overgrowth of a tissue at the site of an injury. A scar is dried serum, blood, and or pus that can occur at the site of an injury or a burn. A fissure is a crack-like lesion of the skin. An ulcer is a circumscribed crater-like lesion of the skin or a mucous membrane. It is important to note that ulcers can occur on the outer surface of the body as well as on the inside. And your word part for this one would be escargot, which is scab. Okay, review question. The term for blister is a cyst, papule, pustule, or vesicle. The answer for this one would be vesicle. It's a larger vesicular, it would be the bulla. Infections of the skin and subcutaneous tissue. The first one is cellulitis, and that is bacterial inflammation that is diffuse, spreading, and occurs within solid tissues. The omphalitis is an inflammation of the navel. Onchia is an inflammation of the nail. It is also called onchitis. Bronchia is an inflammation of the skin surrounding the nail. This can happen when an individual, for example, chews his or her cuticles and they become inflamed. Pyoderma is a bacterial purulent, which means containing pus, which is a skin infection. The pilonial cysts are located in the sacral region of the back and are hairs that grow in a cyst. And you got your word parts. It was a cello is cell, hyphen itis equals inflammation. Omphal, O is umbilicus. Onchi, O is nail. Ia is condition. Par is near. Pi, O equals pus. Derma is skin condition. Pilo equals hair. Nid-O equals nest. And cysto equals sac and bladder. Note that these are still terms related to dermatitis and bacterial infections. A furuncle is a localized superficial staph infection that starts in a gland or hair follicle and is characterized by pain, redness, and swelling. If two or more furuncles are connected by subcutaneous pockets, they are called carbuncles. Impetigo is a superficial vascular pustular skin infection that is usually seen in children, and it can be highly contagious. Dermatitis and eczema. Atopic dermatitis is a chronic pruritic superficial inflammation of the skin that usually occurs in the families that have a history of allergic disorders. Contact dermatitis is an inflammation of the skin that occurs as an irritated or allergic response. Eczema is a superficial inflammation of the skin characterized by vesicles, lesions that weep, and a pruritus. Eczema is also referred to as dermatitis. Pruritus is the medical term for itching. Terms that use pruritus may be described by the area in which the itching occurs. Seborrheic dermatitis is an inflammatory, scaly disease of the face and scalp. In children, it is commonly called cradle cap. Looking over at your word parts, you got A is no, not, or without. Top O is place or location. Dermato is skin. Itis is inflammation. Prurito is itching. Sebeo is sebum. And uric is pertaining to discharge. Okay. Papulosquamous urticaria and the arrhythmia and radiation-related disorders of the skin and subcutaneous tissue. Psoriasis is a common chronic condition disorder characterized by circumscribed salmon red patches covered by thick, dry, silvery scales. Note it is unusual spelling and the pronunciation. Actinic keratosis are skin lesions that are caused by prolonged skin exposure. Urticaria is a skin condition characterized by wheals. Causes are allergic, stress, insect bites, and or drugs. Another name for this could be hives. Your word parts: acti is raise, N equals substance, kerato is hard or horny, and osis is abnormal condition. Disorders of skin appendages. Acne vulgaris is an inflammatory disease of the sebaceous glands. These lesions are papules, pustulars, inflamed nodulars, or comedomes. A comedo is a plug of sebum that partially blocks a pore. Open comedomes are blackheads, which closed comedomes are whiteheads. Alopecia is the term for hair loss or baldness. Hair loss occurs for a number of reasons, including aging, disease, or genetic factors. Alopecia comes from the Greek term alopecia, mange. Mange is an animal disease in which the hair comes out in clumps. Some disorders of your skin appendages. Anhidrosis is an abnormal condition of no sweating. And why is this bad? Sweating is a mechanism to help control the body's temperature. Hidradenitis is an inflammation of the sweat glands. Superportivia refers to the presence of pus from resulting in infection. Hyperhidrosis is an abnormal condition of excessive sweating. Bromhidrosis is a disorder of the apocrine sweat glands, causing an unpleasant body odor. Folliculitis is an inflammation of the hair follicles, and these inflammations can be superficial or deep, acute or chronic. Acute meaning they're happening sudden right now, or chronic means that it's been going on for a period of time. Your word parts: an is no, not without. Hydro is sweat. Hydranano is sweat gland. Hyper is excessive. Bromo is odor or stench. Tricho equals hair. Folliculo is follicle. Hypertrichosis is an abnormal condition of excessive hairiness. Pileosis is a localized patches of gray or white hair, usually caused by disease. A keratinous cyst is a benign cavity filled with epithelium that has become hardened or keratinized. Sebum and epithelial debris. As discussed earlier, a synonym for a keratinous cyst is also known as a sebaceous cyst. Milia is a condition of tiny keratinous cysts that are on the surface of the skin. These are the result of clogged sebaceous ducts. Malaria is a condition of occluded, blocked sweat ducts. Okay, and do be careful. Don't confuse milia, a condition resulting from oil-filled ducts, with miliaria, a condition resulting from sweat-filled ducts. Your word parts: hyper is excessive. Tricho is hair. Osis, abnormal condition. Polio equals gray. Kerato is hard or horny. N is substance, and os is pertaining to. Onchoceratosis is an abnormal condition of an ingrown nail. Onycholysis is a loosening or separation of the nail plate from the nail bed. Onchomalacia is the softening of the nail. Onychokyphosis is abnormally curved or thickened finger or toenail. Onychodystrophy is abnormally developed fingernail or toenail. Your word parts: onchi-o is nail, crypto is hidden, lysis equals loosening, malacia is softening, griph-o is curved, dys abnormal, and trophy equals nourishment and development. Can you remember the difference between these? You got parenchyma versus parenchyma, and hydro versus hydro. The parenchyma is the structure that surrounds the nail, or the parenchyma is an infection of the nail. Also, hydro with an I means sweat, and hydro with the Y means water. Both are pronounced hydro. Other disorders of skin and subcutaneous tissue. The cornification means the process of becoming hard or horny. A callus is a thickened of the stratum corneum that occurs wherever there are areas of pressure or friction. A corn, also called a clavus, is a mass of horny, condensed epithelial tissue that is over a bony prominence. It occurs as a result of pressure or friction. A decubitus ulcer is an inflammation, sore, or erosion of the skin over a bony prominence. These occur most often in the debilitated patients who are immobilized. These ulcers are graded by stages of severity, with the highest grade being a 6, one that is so deep that it has eroded tissue down to the bone. Note that the other names for a decubitus ulcer are a pressure sore or a pressure ulcer. You may have seen them referred to as bed sores. The term decubitus comes from a Latin noun meaning lying down, an adjective related to the elbow. Romans rested on their elbows when reclining. One assumes they eventually suffered pressure sores on their elbows from this constant position. Ichthyosis is extremely dry skin. It is named by the combining form ichthy, meaning a fish become of the scaly appearance of the skin. A milder form of this is ectoderma. Other disorders of the skin and subcutaneous tissue. Dyschromia is an abnormal condition of pigmentation of the skin. If an individual has less than normal pigmentation, it is referred to as hypochromia. If there is more than normal pigmentation, it is referred to hyperchromia. Vitiligo is a condition of patches of skin that lack pigment as a result of an acquired disorder of unknown region. Leukoderma is a loss of skin pigmentation. And then you got your word parts. Dys equals abnormal. Chromo is color. Hypo equals excessive. Hypo equals decreased. Leuko is white. And derma is skin. Some other disorders of the skin or subcutaneous tissues is lentigo, is darkened macules caused by sun exposure, otherwise known as age spots. Skin tags are soft, pedunculated, literally meaning that they are little foot lesions that are an outgrowth of the epidermis and dermal tissue. These occur most often in multiples on the neck, eyelids, armpits, and groin. A synonym for skin tags is acrocordons. A discoid lupus erythematosus is an autoimmune skin condition characterized by red, round-shaped lesions. Seborrheic keratosis is a benign, pigmented, warty lesion. It is caused by abnormal flow of sebum and is abnormally hard or horny. Don't confuse seborrheic keratosis with actinic keratosis. It is a hardened skin lesion that is caused by exposure to the sun. Your word parts. Disco equals disc. Erythematose is red. Sebo is sebum. Arythmic is pertaining to drainage. Cato is hard or horny. Osis is abnormal condition. Exero is dry. Cuto is skin. And is noun, is a noun ending. Some viral infections characterized by skin and mucous membrane lesions. Exanthematose disease are those that are characterized by a rash. Measles, mumps, fifth disease, rubella, and chickenpox are examples of exanthematose diseases. Herpes simplex virus 1 are viral infections that cause clusters of small vesicles on raised inflammatory sites on the skin or the mucosa. HSV1 causes fever, blisters, cold sores, herpetic stomatitis. They are also synonyms for each other. And keratitis, an inflammation of the cornea. Point out that the cornea is the hard outer covering of the eye. It uses the same combining forms, corneo and kerato, as the combining forms used to describe hard, horny conditions of the skin. Remember that stomatato means mouth, not stomach. HSV2 is commonly known as genital herpes. Herpes zoster is an acute painful rash caused by a reactivation of the latent varicella zoster virus, the one that causes chickenpox. This disorder is more commonly referred to as shingles. Verruca is a medical term for wart. These are caused by a virus and can appear on the skin in various locations on the body. For example, plantar warts appear on the soles of the feet. The plantar surface. Note that the plural form of the term verruca is verrucae. Mycosis. Candidiasis is a yeast infection that is also called monilitis. Another term for fungal infections of the skin is dermatomycosis. Fungal infections are named by the specific body by using the term tinea for fungus, and a second term indicating the area of the body. Tinea capitis is a fungal infection of the head. Tinea corpus of the body. Tinea crucis of the groin, also known as jock itch, and the tinea pedis of the foot, also known as athlete's foot. Your word parts would be dermato is skin, myco is fungus, osis is abnormal condition, capito equals head, is equals structure, corpo is body, cruro is leg, pedo is foot, and anchio is nail. Pediculosis is an infection with lice, while scabies is an infection with mites. Infestation with scabies causes an itchy, pruritic papular rash. Note that these two are parasitic infestations, as that the common names are lice and mites. The word parts would be pedicular is lice, and osis equals abnormal condition. A review question. The combining form for dry, as in dry skin, is what? A. Xero, B. Myco, C. Surdori, or D. Myo? The answer is A. Xero. Review question number 2. The term that means abnormal condition of fungus in the nail is what? Hyperhidrosis, onychomycosis, trichomycosis, or onychokeratosis? And the answer for this one would be B, onychomycosis. Burns. Degree of burns. Burns are injuries that can be caused by heat, radiation, chemicals, or electricity. The severity is measured in degrees and in thickness. If degrees are used, they are first-degree burns, which damage the epidermis only. First-degree burns are characterized by erythema, tenderness, redness, and hyperesthesia, which is heightened sensitivity to touch. Another name for a first-degree burn is a superficial burn. Second-degree burns involved the epidermis and dermis, with erythema, vesicles, and likelihood of scar formation. These are also called partial thickness burns. If the burn damages the top part of the dermis, called the papillary layer, it is a superficial partial thickness burn. If the entire dermis is damaged, meaning that the reticular layer is included, it is referred to as a deep partial thickness burn. The third-degree burns are those that are damaged the epidermis, dermis, and subcutaneous layers. Because the nerve endings in the dermis are destroyed, this type of burn does not cause pain. This is also called a full-thickness burn. Although not a common category, fourth-degree burns are those that destroy the epidermis, dermis, and subcutaneous layers, along with the muscle and or bone underneath. This is also called a deep fullness burn. Burns, the rules of 9. The rule of 9s is used to describe the percentage of the body that is affected by a burn by dividing the body into multiples of 9. As you can see on the ventral surface of the body, 4.5% is allowed for the head and neck, 4.5% of each arm, 9% total for the front of the arms, 18% for the front of the torso, 1% for the groin area, and 9% for each leg, which equals 18% total for the front of the legs. That gives us 50.5% for the front of the body. Now on the dorsal side surface of the body, we again have 4.5% for the head and neck, 4.5% for the back of each arm, which equals 9% total, 18% for the back of the torso, and 9% for the back of each leg, 18% total for each legs. If the total back of the body is 49.5%, then the total for the body is 100%. Review question. Only the epidermis is damaged. In which type of burn? Superficial partial thickness, deep partial thickness, superficial thickness, or full thickness? I'll give you a little hint. It's also known as a first-degree burn. So that would be C, superficial thickness. Benign skin growths. An angioma is a tumor of a vessel. A hemangioma is a tumor of a blood. A dermatofibroma is a fibrous tumor of the skin. These lesions are firm, round, and usually appear on the extremities. A lipoma is a fatty tumor. It is soft, movable, and located in the subcutaneous tissues. Your word parts: angio, vessel; oma, tumor; dermato is skin; fibro is fiber; and lipo equals fat. Benign skin growth. A nevus is a birthmark or a mole. By themselves, these are not a problem. If they are dysplastic, however, it means that they have an abnormal formation. They can progress to becoming malignant, and the ABCDE rule is used to monitor changes that indicate a need for further evaluation. A equals symmetry, which is abnormal, uneven shape. B equals borders, irregular. C equals color, any change in the color. D is diameter, greater than 6 millimeters. And E equals elevation and any increase in size. Malignant neoplasms. A basal cell carcinoma are the most common form of skin cancer. They originate in the lowest layer of the epidermis and usually occur on the face and other areas that are chronically exposed to the sun. Basal cell carcinomas rarely metastasize. Kaposi's sarcoma is a rare form of skin cancer that occurs most often in patients with deficient immune systems. The nodules, usually red, blue, brown, or purple, usually occur on the extremities. A malignant melanoma is the result of a mutated melanocytes. It is the leading cause of death for skin cancer. Squamous cell carcinomas are the second most common skin cancer. These arise from squamous cells instead of basal cells. Although like BCCs, They are also the result of sun exposure. Review question. A fatty tumor is A. Dermatofibroma, B. Dysplastic nevus, C. Acrocordon, or D. Lipoma. And if you're talking about fat, remember your word part. Lipo equals fat. So a fatty tumor would be D. Lipoma. Biopsies. Each of these biopsies involve examinations of living tissue. An excisional biopsy is one in which the entire tumor is removed along with its borders and as a means of diagnostic and treatment. Exfoliation is a scraping or shaving of samples of friable, easily crushed lesions for examination. An incisional biopsy is a cutting of a wedge of tissue from a lesion followed by suturing the site closed. A needle aspiration biopsy is an aspiration of fluid from lesions for culture and examination. And a punch biopsy is the insertion of a tubular punch through the skin to the subcutaneous tissue to extract a core of tissue for examination. Laboratory tests. Bacterial analysis are cultures and serologic exams of fluid removed from lesions to determine the type of bacterial. Fungal tests are scrapings of lesions such as tinea to determine the type of fungus. A sweat test is done to test for abnormally high levels of sodium and chloride that are characteristics of cystic fibrosis. An intradermal test for tuberculosis is the Mantoux test. It is using peripheral protein derivative, also known as the PPD, to test for active or dormant tuberculosis. The Zant test is used to test for herpes zosters and herpes simplex. Viral cultures are samples of vascular fluids to help identify the type of virus in a lesion. Wood's light examination is a method of detecting tinea or pseudomonas in burns. Wound and abscess cultures are samplings that identify pathogens in diabetic or decubitus ulcers, postoperative wounds, or abscesses. Review question. Which type of examination technique is used to determine if a patient has either herpes simplex or herpes zoster? A viral culture, B, wound and abscess culture, C, a Zant test, or D, Wood's light examination? The answer is C, the Zant test. Grafting techniques and other therapies. The work of replacing skin can be a complicated procedure, including several separate activities. Two types of surgical replacement can include grafts and flaps. The use of a flap as replacement tissue means that it has an intact blood supply, so from the patient himself or herself. Grafts, however, do not have any intact blood supply. They can be from an identical twin, which would be called an isograft. Another person is allograft, or another species is exograft. Again, the patient himself or herself will be an autograft. A dermatome is an instrument to cut thin sheets of skin to be used for donor skin. So some of the other grafting techniques would be laser therapy. Is used to repair or destroy tissue, such as port wine stains, tattoos, or psoriatic lesions. Occlusive therapy is the use of dressing that closes off an area of the skin to increase the effectiveness of the absorption and the effectiveness of medication. The Soralan Plus and ultraviolet is a therapy in the use of ultraviolet light on psoriatic lesions. Tissue removal and other procedures. Cauterization is the burning of the tissue in order to destroy them. Cryosurgery is the use of extreme cold to destroy lesions. Curettage is the scraping of material from the wall of a cavity to obtain tissue for microscopic examination. The instrument used is called a curette. Debridement is the first step in the wound treatment. It is the process of removing dirt, foreign bodies, damaged tissue, and cellular debris from a wound or burn in order to prevent infection and promote healing. An eschorotomy is an incision to cut and remove a scar, the scab that forms over a burn. It is done to prevent edema that can cause a lack of blood flow, also known as ischemia, to the underlying tissue. Incision and drainage, also known as an IND, is the cutting open and the removal of contents of a cyst, wound, or other lesion. Shaving and paring is the slicing of thin sheets of tissue to remove lesions. Mohs surgery is the repeated removal and microscopic examination of layers of a tumor until no cancerous cells are present. Maps of tumor location drawn from frozen section specimens indicate areas of remaining tumor that must be removed. As you see on the slide, it shows you an animation of a Mohs microscopic surgery. Some other tissue removals and other procedures. An osteotomy is the removal of nail, usually to treat trauma. An osteoplasty is the removal of a nail matrix to treat ingrown toenails. An osteotomy is the cutting of a nail to drain a subungual hematoma. Your word parts. Osteo is nail, out. Plasty is surgically formation, and tummy is cutting. Cosmetic procedures. If you need your eyelids done, you would have a blepharoplasty. A chemical peel is the use of mild acid to produce a superficial burn. This procedure is used to remove wrinkles and fine lines from the face. A dermabrasion is a surgical procedure to resurface the skin. It is used to remove acne scars, moles, wrinkles, and tattoos. Dermatoplasty, although literally the surgical repair of the skin, is the transplant of living skin to correct the effects of injury, operation, or disease. And your word parts. Blepharo is eyelid. Plasty is surgically forming. Dermo is skin. And abrasion equals scraping. A lipectomy is the removal of fat. Liposuction is a technique for removing excess adipose tissue with a suction pump device. A radiodectomy is a surgical procedure to remove wrinkles. This is also commonly known as a facelift. The word parts is lipo is fat. Ectomy, cutting out. Lipo, again, fat. And retido is wrinkle. Review question. What is the destruction of tissue by burning? A. Cauterization. B. Cryosurgery. C. Debridement. And D. Mohs surgery. I'll give you a little hint. If you think of your word parts, what means cauter is burning. So if we are burning the destruction of tissue, it would be A. Cauterization. Your pharmacology. Your anesthetic agents, that's the cause of loss of sensation, is topically applied. Its anesthetic agent act locally on the infected area. Antibacterials prevent and treat bacterial growth. Antifungals treat fungal infections. Antihistamines suppress the allergic responses to reduce itching, redness, and swelling. Anti-inflammatories reduces inflammation. Antipsoriatics treats psoriasis. Antiseptics prevents infection by destroying microbes on skin or tissue surface with topical application of agent. And antivirals reduces the effect of viruses. Emollients soften and moisturize the skin, applied topically. Immunomodulators or immunosuppressants, agents that suppress the body's immune system. Keratolytics break down hardened skin and shed the top layer of dead skin to treat warts, calluses, corns, acne, rosacea, or psoriasis, and it is applied topically. Pedicellulosides destroys lice. Protectives or protectants, they protect the skin against sunlight with sun protection factors, which are known as SPFs, applied topically. Retinoids alter the growth of the top layer of skin and may be used to treat acne, reduce wrinkles, and treat psoriasis. And then scabidicides destroy mites and scabies. Suffixes and root operations for skin and subcutaneous tissues. Abrasion is extraction. Ectomy is excision, resection, and alteration. Graft is repair. Plasty, repair, replacement, supplement, or reposition. And tomy is drainage. Notice that some of these suffixes have more than one root operation that may be assigned. Remember that it will all depend on the purpose of the treatment to determine the particular root operation coded. Some short terms into their correct categories. Now you're going to take the terms and you're going to add the numbers over to the categories. So your terms is 1 is clavis, 2 parenchyma, 3 melanin, 4 xenograft, and 5 needle aspiration. So what is anatomy and physiology, A and P? That would be 3 melanin. Pathology could be 1 and 2, clavis and parenchyma. And then a procedure, there you got 2 here. You've got your needle aspiration and also xenograft. And this concludes the lecture and PowerPoint for skin and subcutaneous tissue.